The penile implant is usually reserved for patients who have previously failed the treatment algorithm of pills, gels, injections, or patients that want more of a spontaneous response to their erectile dysfunction. I think sometimes thinking about having to take a pill or inject the penis with a needle, some patients are apprehensive about that. I think a penile implant's a great option because it enables the patient and empowers them to have immediate activation and utilization at their discretion. Yes, most major carriers and Medicare do cover the penile implant. It is a medical necessity, and patients can check with their insurance provider prior to surgery, but for the most part, my office will work with the insurance carrier and ensure that the patient's implant is covered. During my preoperative assessment, I assess a patient's dexterity because there are two types of implants. There's a malleable implant, which always maintains a semi-erect state where the patient is able to just prop the penis up from a bent position to a more straight position for utilization during sexual activity. And then there's an implantable, inflatable device that the patient is able to depress a pump that's implanted inside the scrotum, which pulls fluid from a reservoir that I implant in the abdomen, a reservoir that I implant into the abdominal cavity, which that fluid then inflates cylinders that I implant within the shaft of the penis into the erectile bodies of the penis. It's all concealed. There's nothing that the patient or their partner would be able to visualize from the outside. These are all internalized components. The main difference between a malleable and an inflatable implant really is the mechanism of action. The malleable is always going to be in a semi-erect state where the patient is able to bend the penis and utilize it for penetration and sexual activity, whereas an inflatable implant is one that the patient will need to mechanically compress the pump that's implanted into the scrotum, which will then pull fluid from the reservoir that's implanted into the abdominal cavity, and it will force fluid into the cylinders that are implanted in the penis to achieve an erection. Implants are sized based off of the patient's anatomy. I take an individualized approach to every patient, and during the operation, I'm able to assess and evaluate exactly what size implant I can place, and I always go for the biggest size physically and humanly possible. Manual dexterity is really the only necessary prerequisite to being able to operate the device. The implant is placed within the penis, and the patient just depresses the pump that's in the scrotum and is able to pull fluid from the reservoir into the cylinders and operate the device that way. As long as the patient has intact anatomy and has not had a prostatectomy, they will continue to have ejaculation and the sensation should be the same. We don't touch the nerves to the penis. We put in the device beneath all the nerves and do not displace or touch those at all. As far as post-prostatectomy penile implants, since the majority of the ejaculate fluid is prostatic secretions and fluid from the seminal vesicles, those patients will not ejaculate fluid. However, orgasm and sensation should also remain intact for them as well. All components of the penile implant are concealed. The reservoir is implanted underneath the muscle of the abdominal wall. The pump is implanted into the scrotum, just behind the testicles, and the penile cylinders are implanted into the erectile bodies of the penis, and these are all internalized components that the patient and their partner will not see from the outside world. The inflatable penile prosthesis consists of three components: a reservoir that contains the fluid that will then be moved into the cylinders that are implanted inside the penis, into the erectile bodies of the penis, and then the pump, which is implanted inside the scrotum. So there's three components: reservoir, pump, and the cylinders themselves. It's saline, it's just salt water. I make a small incision in the scrotum, just at the bottom of the shaft of the penis, and then I implant the cylinders within the erectile bodies of the penis themselves, and then I place the reservoir into the abdominal cavity just underneath the muscle, and I implant the pump itself into the scrotum just behind the testicles. The patient can either go home the same day or stay in the hospital just one night. The recovery entails about a week of soreness and some bruising, and then I'll see you at 2 weeks of follow-up just to ensure that everything's healing correctly, and then we can start cycling the device at about 4 weeks. The device can be used typically about 4 weeks after surgery. An implant will typically last about 10 years. There's high satisfaction with the patients themselves, and not to forget, the patient's partners are also expressing high levels of satisfaction. Anytime a patient has a foreign body implanted, whether it's an implant or mechanical device or medical device, there is a potential risk of infection. However, we give antibiotics before surgery and during the operation, as well as after the procedure for about a week. So we really take all necessary precautions to mitigate the risk of postoperative infection.